Hi everyone. Today we're talking about something that's important for men's health, but not always openly discussed. The prostate gland. Now I know what you're thinking. What's the prostate, or even why do I need to know about it? Well, I'm here to give you the scoop, along with explanations of two common conditions that affect it: benign prostatic hyperplasia, or BPH, and prostatitis. So grab a drink, sit back, and let's dive into the world of men's health in a way that's simple, clear, and yes, interesting. All right, first things first. What is the prostate? The prostate is a small gland, about the size of a walnut, found only in men. It sits just below the bladder and in front of the rectum. Think of it as a donut with the urethra. This is the tube that carries urine out of the body, running right through the middle of it. Pretty interesting, right? Now, why is the prostate important? The main job of the prostate is to produce fluid that mixes with sperm to create semen. This fluid helps to protect and nourish sperm, giving them a better chance at successful fertilization. So, it plays a key role in reproduction. Now let's talk about two conditions that can affect the prostate: benign prostatic hyperplasia, or BPH, and prostatitis. Though both involve the prostate, they're different in causes, symptoms, and what's actually happening in the gland itself. Let's start with BPH. BPH is essentially a fancy way of saying the prostate is getting bigger. Benign means it's not cancerous, and hyperplasia just means the cells are growing more than usual, causing the gland to enlarge. When the prostate gets too big, it starts squeezing the urethra, making it difficult for urine to flow normally. That's why men with BPH often feel like they need to go to the bathroom all the time, or they struggle to empty their bladder completely. So, why does BPH happen? The exact cause isn't fully understood, but we know it's very common as men age. In fact, by the time a man reaches his 50s or 60s, it's pretty likely he'll experience some degree of BPH. Some researchers think it's related to hormone changes, especially with testosterone. Another idea is that genetics play a role. If BPH runs in the family, you might be more likely to experience it too. Alright, now let's look at prostatitis. While BPH is mostly about the prostate getting bigger with age, prostatitis is a bit different. It's actually an inflammation or irritation of the prostate gland. Think of it like this: where BPH is a growth spurt in the prostate, prostatitis is like a sore or infection. There are a few types of prostatitis, but the two most common are bacterial and non-bacterial. Bacterial prostatitis is usually caused by an infection, similar to how a bladder infection works. Non-bacterial prostatitis, on the other hand, isn't due to an infection, but can still cause pain, discomfort, and urinary issues. Who gets prostatitis? Well, it can happen to men of any age, but it's most common in younger to middle-aged men. Bacterial prostatitis often starts with an infection elsewhere, like the bladder, which then travels to the prostate. Non-bacterial prostatitis is a bit more mysterious. It could be related to stress, pelvic floor issues, or even nerve problems, but doctors are still figuring that one out. So let's recap. BPH and prostatitis both affect the prostate, but they're different. BPH is a non-cancerous enlargement of the prostate, usually due to age and possibly hormones. It mainly affects how you urinate. Prostatitis, on the other hand, is inflammation that can be caused by infections or even stress, and affects men of all ages. To put it simply, if you or a loved one notices frequent trips to the bathroom, difficulty starting or stopping the flow of urine, or pain in the lower back or pelvic area, it might be time to talk with a doctor. These could be signs of BPH, prostatitis, or something else, and it's always best to get checked out. Thanks for watching, and remember, knowledge about your health is power. Stay tuned for more health tips, and please share this video with someone who might find it helpful. Take care, and see you next time.